Thank you everyone for joining us. I hope all of you have had lunch. I know this is a very odd time that we've been stuck in. Before we start, just a very quick show of hands, just for us to make sure that this conversation of most value to you. How many of you here are from non-profit organizations? Okay. Any of you here who are from CSRs? Okay. Any of you who are neither CSRs nor non-profits? Okay. How many of you are already working in digital health interventions at scale on the ground? Got it. How many of you are considering digital health interventions on the ground? Okay. So the goal for us as panelists is to make sure that by the end of the session, everybody raises your hand. Yeah? I want to set the context very quickly and then move to the questions to my panelists. Today, one of the most growing trends in healthcare space is the use of digital. What recently has been found out is that 75% of Indians, not just Indians in urban India, but Indians, use some form of digital health services. Yeah? Aspects in some sense in terms of telemedicine and other forms of healthcare are actually reaching different parts of India already. There are many startups that have come up in this space. And of course, government has launched the Ayushman Bharat Digital Mission to be able to promote healthcare and digital health in this space as well. Unfortunately, despite all of this, only 7% of all the money that is invested in health today is invested in digital health. And despite all of the scale and the promise of scale, a lot of the traditional work that nonprofits do haven't found ways to integrate digital health as part of their interventions. So what we want to do today really is to focus on two questions: the why and the how. Why do you have to invest in digital health? And if you want to, how can you do it in the best way possible? Yeah? This one I want to start with you. If you had to give a set of reasons for people in this room as to why they should consider digital health as part of their health agenda today as a non-profit or a CSR, what would you say?
So first of all, thank you very much to CSR Box for having us here. Looking forward to the panel discussion. We have some great panelists on the board as well. Just to give you a little bit of my context, I've been involved with digital health for about 20 years. The first 17 of them starting and running a company called Citius Tech, which is a digital health tech company focused largely on global markets, US and Europe. So we've kind of done a lot of work there. And the last 3 years, more actively in the foundation, and more recently as the chair of NABH, I've been involved a lot with digital health in India. If you look at the context of healthcare in India, there are, just to put things in numbers, there are about 100,000 hospitals. There are about 200,000 labs and pharmacies. There are about 2 million doctors. It's a very complex ecosystem because 95% of all these healthcare providers are small entities, under 10-bed, 20-bed hospitals, single physician clinics. There is massive disparity in the availability of doctors across India. There is a big rural-urban divide. And while a lot of stuff is happening in other sectors, it just seems that there is a level of stagnation in the way healthcare gets delivered across the country. And we know for a fact that if you look at the context of India in many other sectors, if you look at financial services, the way banking was delivered to the common man 20 years back versus what we can now do with online banking and with UPI, and the way we were able to buy and sell things 20 years back versus what we can do right now. The way in the middle of COVID, you could order biryani from the best place you wanted, and for each of the places you wanted, you would know exactly what the rating was. But if your father or mother had COVID, then you would literally have to take that individual in a taxi or in a car and go hospital by hospital trying to figure out which hospital has a bed and which doesn't have a bed, right? So just the level of disconnect between what is happening in other sectors and how those have become more efficient versus what's happening in healthcare could not be more disparate. And therefore, I know many of y'all are in the not-for-profit sector here in healthcare, so y'all don't have to, in some ways, y'all already a convinced audience, that's why y'all do what you do. But there are many of y'all from the CSR, from corporate CSR groups and other philanthropy organizations in the audience. And as we go through today, I hope you get convinced that given all the things that are happening in the country in healthcare, the incremental rupees spent on digital gives a far better return on investment than we can ever hope to get by adding an extra bed or an extra MRI machine or whatever. Not that we don't need it, but just on an incremental basis, there is a tremendous amount of return on investment opportunity for your CSR rupee in digital health compared to any other sector. So I'll just pause here and we'll come back to this theme again later. Yeah.
Rizwan, if I could maybe follow up. What you just said about the transformative value of that incremental rupee in digital, can you give an example? Saying, here is an example of a digital health investment that actually can create transformative value per rupee invested.
So I'll give you an example. Imagine you wanted to build a 100-bed hospital. And if you had to build a 100-bed hospital, it would cost you around, give or take, between 20 to 50 crores. And that hospital would then have thousands of patients and come in and go out on a monthly basis. If you had to put an electronic medical record system to be able to capture patient data in it, which, by the way, more than 98% of hospitals don't have, right? It will cost you an additional 1 crore rupees. Or maybe even less in some cases, yeah. But now with that incremental investment of 1 crore or whatever, you could take a 50 crore investment in a hospital and make sure that every single patient that is coming in has got a health record which is digitally captured in the hospital and not on paper. Every single patient which is walking into the hospital now can get registered faster. They are able to view their health record from the confines of their home if they wanted to. They can potentially use the tools like ABDM, others to share those records with other doctors. If they went back to a follow-up, then even if they forgot a lab report at home or they just lost it, the next doctor will have access to it. Now, if you are funding that hospital, is that extra 1 crore better spent in adding 2 more beds or making sure that the 100 beds that have already got built are able to serve patients in a much more effective manner, right? That's the question you want to ask. That's just one example. I could give you many others, but this is just one example that to make the point.
That's a fantastic example, Rizwan. And I think we underestimate some of these disconnects that in the absence of digital can happen, where every time we go to a doctor, we forget a report and the doctor has to ask us a ton of questions to be able to even figure out what is the problem. Now, thanks for sharing that. Sunita, I want to come to you. Sunita, you've had some interesting vantage points. You've been in a corporate, and as part of a corporate, you've looked at the health landscapes, and you've worked within the public health system at the very last mile to see how digital can add value. As you see it now, are there certain things that you find very exciting in terms of trends and patterns?
Yeah. So just as context, I've been in the tech sector, started off working in the Silicon Valley, worked in India in the development sector with grassroots NGOs for 10 years. But in the last 10 years, both in the health and water sectors, I've been working with governments on how technology can be used to increase and improve the societal impact that the programs are designed to do. And I think one of the key things, if many of you seem to be from NGOs here, right, from nonprofits, so you're probably used to working the standard ways of mobilizing communities, ensuring the last mile reach, making sure that, the poorest of the poor get access to services. All of these things that NGOs do very well don't always scale when you start working with government, right? And that we've seen this over and over. We've seen this across sectors, we've seen this across programs. What we feel in the last 10 years, what I've seen is that by effectively employing technology, you can achieve the same quality. You can at least aspire, you can get there, it'll take time, but you can achieve the same quality that NGOs can do at a very small scale. Right? And this is extremely important because eventually many of the government programs, what they're trying to do is to get universal reach. Right? They want to ensure if it's, I was working with Government of India on the national NCD program. And the NCD program is looking at preventively screening, treating and managing hypertension, diabetes and cancers for every individual over the age of 30. And that means 37% of the population, which is 500 million people. Staggering number, right? 500 million people. Now, obviously, it's not something that if you go by business as usual, then you're just getting a set of numbers back and nothing is actually happening on the ground. How can you use technology to make an impact? And this is what really excites me. This journey of, you know, when I first started working with health workers about 10, 15 years ago, they were using paper registers, right? Each health worker would be managing 50 registers, going door to door, doing community needs assessment, doing all of the stuff, mobilizing people. But obviously, that's a very painful way to go around doing their work. The burden was huge. We did some time and motion studies and looked like they were spending 1 or 2 hours every day just doing paperwork. And then they have to submit it to the PHC, who then has to submit it to the district, and at every point, there's a lot of paperwork. So obviously, it's a no-brainer. If you give them some digital tools, right, then will that could dramatically improve the amount of time they spend. We did that, but this is not a simple, straightforward journey. Every program said, okay, great, let's give them a digital tool. So then every one of the national vertical programs, RCH, TB, NCDs, you know, leprosy, everybody had their own nice app. And suddenly this poor the poor health worker who was earlier trying to manage 50 registers now had like 50 apps. Maybe not 50, but it was pretty hard for her. And they're not digitally literate. You know, I've worked with like 500, 600 health workers that I've trained personally. And every time there's so much resistance saying, why do we have to use this technology, right? So now, I think the next generation, going past pure digitization, if you look at what's coming up today, the power of AI, conversational AI, local language, if the health workers and doctors are able to just speak in their local language, if they're able to get support, if a patient who's just been diagnosed with hypertension and the doctors reeled out a bunch of medicines and a bunch of things they have to do, they go back home and they're able to get some help when they're sitting there bewildered and confused in their local language, I think that can be really transformational. Now, for all of these to happen, you need a lot of investment, not just money. You need time, you need effort from every individual here to mobilize people on the ground, to evangelize, to get people to adopt technology. I think that's the big opportunity and the challenge in front of us.
I want to ask the audience a question. When Sunita said this, that ASHA worker speaking to her phone in a local language to provide health information, how many of you think this can happen in the next 6 months in India? No, that's the point I wanted to make because some of them didn't raise hands. Sunita, how far are we from that reality today? Are we already there?
Well, in India, nothing is ever a 1-0, right? There are places where it's actually already happening, and that's what gets us all excited. But there are places, you know, when we were working on the national NCD program, there were places like 3 years into the program, they hadn't even procured the devices, right? So it is a big continuum, and there will be states or districts or, you know, facilities which might take a few years to get to the starting point, and then there are others.
And what you're saying is that what is holding us back is not the technology. It is the readiness of the system to do things like procurement and training.
Absolutely.
And also why the role of nonprofits becomes critical. Because today it's not the promise of technology, it's the ability to work with the system to get it ready that is important.
You need a lot of brokers, right? You need people, if a government is trying to implement this program, you need people who understand both the power of technology, who are excited by that, and who are willing and patient to work with the system to help people adopt technology. That's really important. So,
Anshu, I want to come to you. There has been a lot of excitement around ABDM. There's been a lot of discussions around it. But why is it so transformative? What is that thing that it's unlocking for us, which should be exciting for everybody in this room?
So, picking up from where Sunita basically left right now, one thing that you mentioned was all these government health programs having paper registers and everything. But ultimately, if you think what ties all of them together, you require a common platform which basically makes these applications interoperability across applications. Let's put it that way. So ABDM brings in that particular layer wherein you can expect all applications to be interoperable, irrespective of whether it's a government program, an HMI solution, or a laboratory solution, everything across this board. More importantly, what it brings is, when you think of all these programs, you need structured data. So the flow of structured data unlocks, let's say, massive value or efficiencies across the ecosystem. So that is the more important part, and that's the value add. In today's date, ABDM is close to around, it was officially launched across the country as ABDM in 2021, but its precursor was the National Digital Health Mission in 2020. It's been 4 years since then, and I think with approximately 67 crore citizens or 3.5 lakh health facilities in the system right now, we are, let's put it that way, that we are a long way to go right now. We still have to, even despite saying 67 crore people have their Aabhas, how many really use it? Not many. Does anybody realize the value? That is where the focus is right now. We have moved away from filling up the, let's say, getting these health IDs in, to a case wherein you can have these health records linkages that is getting tracked. And I think that is where the system is moving. So that is more important.
And I think the point you're making, which I think is very, very important, is if we can create this national infrastructure to share health data across various existing systems, it makes interoperability a lot more easier and makes access to information so much more easier for the citizen as they move from one place to another, as they move from a hospital to a pharmacy to a diagnostic center, etc. And I think the government holding that, and I know, Anshul, that this is also a very different paradigm from countries like US and how they have done it, right? Where it is essentially private health data that is sold by companies to where government is building the rails for this to be able to make happen. Yeah?
Correct.
Thanks. Rizwan, I think the joy of having you in a panel is that you play such different roles. And I can ask you one question per role that you play. So one of the roles that I know you play is helping nonprofits with adopting digital. I often joke that what staircases of a Kung Fu Panda, digital is for nonprofits. It is inherently scary. One of the things that's holding back people here is a sense of, hey, how can digital become part of the way I work in terms of capability? From your role in Quite a Foundation, how do you see that?
So, we've been working with not-for-profit organizations in our foundation and helping them through their digital journey for almost about 8 years now. And over the course of time, we've probably helped about somewhere between 30 to 35 NGOs scale using technology. What we find is that if you look at India, at one hand, it's surprising that we have the largest amount of technology professionals globally, with the strength of the IT services industry and many others, right? With this massive capacity. But if you look at the NGO world, then the reality is that it's very hard in the NGO world to be able to hire and definitely retain technology professionals. So. Number one, if I'm running a small mid-sized NGO, it's very difficult for me to get the right talent. Even if I hire a junior person to run my IT systems or networking, is not the individual that I will sit down with to define my IT strategy or whatever, right? So one of the things that the foundation has done is actually helped NGOs do that. The reason that is very important is because if you look at the evolution of any organization, whether it's commercial or whether it's the not-for-profit organization, if I'm running an NGO and if I've got, say, 100, 150 field workers, and each of them are filling up paper records and they are coming back, then it doesn't matter how hard I try to manage them better. The reality is that attrition in the field force is usually very high. The caliber of people in the field who are working for most of the NGOs tend to be from the community, so they're not necessarily massively educated or what have you. And thirdly, the productivity, right? When you're constantly filling up things and trying to compile. So when we are able to convince the CEO or the founder of the NGO that investing time and effort in building, not for everything, you don't have to, quote unquote, I have to digitize everything. That is absolutely the wrong way to do it. But if you take some of your core activities, right, you could be a mother and child NGO, and your core activity is the work that your field worker is doing, meeting mothers and children and taking some of the measurements or what have you. It could be NGO in education, and you may be having teachers who are going and teaching kids, Balwadi kids or other kids. So those are your core activities. If you can identify what your 2-3 core activities are, and you can find a way to support your field workers in doing those core activities, they give a massive kick in improving quality because now it gets more standardized, improving productivity because now it takes away the manual time, but it also improves the transactions become faster, and it ensures that you have complete traceability of which person is doing what, how are they doing it. The most important thing for the NGOs that we find is if they're able to do this thing well, when they go back to their donors, right? They go back to their donors and say, hey, earlier you were giving me 100 rupees, and with the 100 rupees I was able to serve, say, 20 beneficiaries. Now with the same 100 rupees, I can actually service 30 beneficiaries. And what that does is it increases the value of that NGO in the minds of the donor. And the donor then, who was very excited about giving money, 100 rupees for 20 beneficiaries, is now actually getting 50% more bang for their buck, right? They're actually able to, with the same 100 rupees now, this NGO is able to service 30 beneficiaries. They're much more open to contributing more to those not-for-profit organizations. So what we see is that not only have they got all the benefits of digital, but when they go back to their donors with the right story, they appear so much smarter with their NGO, with their donors. And on a consistent basis, we see in 2, 3, 4 years, the size of these NGOs start to scale like you would expect, right? So it's been a phenomenally exciting journey for us in supporting these NGOs. And I think that hopefully answers your question.
Yeah, thanks, Rizwan. Sunita, I want to come back to you, to something that we were discussing earlier. I've seen the 10 years of CSR journey, and I think there is a remarkable change in the ambition that companies are bringing to CSR today. And I often believe that if the ambition is set, the way to figure it out is possible. But when you think about the work people do in CSR, often it is just ambition to do more of the same thing. In Dell, you took a very different approach. You sort of redefined what companies can actually do. For the people in the room here who are from CSR, can you maybe talk about that experience and the learnings that others can sort of emulate as well?
Yeah. No, thank you, Ratish. This is something that I feel very passionate about, so glad to talk about it. But first, I want to say that was a wonderful example. It really, was very eye-opening. So I was at Dell until last year. I was the leading social innovation at Dell, looking at how technology could be used for societal impact. That's basically Dell CSR, right? ESG. For the last 10 years, through Dell, at Dell, we've been working on digital health, partnering with government as a technology partner for Government of India. And this is one of the programs. There are a couple of others too, but I want to focus on this one. As technology partner to Government of India, the Dell team, my team, we were developing the software system, designing it, developing it, working with government, literally embedded inside government. People would joke saying that we're not sure if you work for Dell or if you work for government, because it required that kind of deep engagement, working with states, helping deploy this software across the country, getting it to be adopted. It's running in 32 states with some 400 million people enrolled. So as the prime technology partner with Tata Trust, we were very actively involved in every aspect, from product design to development, deployment to policy to adoption, training, all of it, right? This is very unusual for a typical CSR. Typical CSRs tend to say, we'll write out a check and you can go fund, paint the school, plant some trees, support a feeding program, whatever. You support those programs. I feel that kind of, we are underplaying. We are, punching below our weight. We as in the corporates who are doing the CSR. Many corporates have the capabilities, IT, technology capabilities, program management capabilities, professional experience amongst all their employees, and using just a fraction of that towards CSR, towards your CSR effort, can make a huge difference in, the, in that particular sector. Now, if you're working with government and if the company is able to take a few individuals, we had like, a fairly significant sized IT team that was dedicated to, can you hear me? Yeah. That was dedicated to this program, software developers, program managers, all of that stuff, right? If every company could do that, we would see digital adoption, digital transformation really accelerate, right? So companies should really think, and all of you can start putting pressure on your particular stakeholders to say, let's think about philanthropy differently. It should be strategic. There's a big mismatch between a company of highly trained, highly professional, qualified execs and developers doing something very simple like writing out a check and that's it, very hands-off. You're not utilizing your potential. So I feel this is something that, I really hope more companies would do.
Completely agree. And I think the question that everybody should ask is not just what is the problem that I can solve, it's what is the problem that
So if any of the entities over here is working back with the hospital and you also have patients who are supported through the government schemes, insurance, etc., there is a real value add wherein the claim settlement will be happening much, much faster going forward. When the DSO goes much below the standard timelines, there is automatic savings that come up over there. Apart from that, also there are, when you digitize your entire program, like let's say the healthcare program, whatever you're working with, there's a value add also in terms of the insight that you gain from it. Because you don't look at everything in silos, rather holistically across the ecosystem. So I think that those are the main things that both digitization as well as ABDM bring in.
I think the point you made on insurance is a very, very important one. Check. Yeah. I think the point that you made on insurance is a very important one. I still think that is one of the greatest black boxes in the health system, which is what claims get approved, when will I get the money, and cash flow is everything. So if there are ways in which we can make cash flow possible for the poor, I think that's an area that everybody should consider very actively. Rizwan, I have the last question for you, and then we'll open it up for the audience. And I request all of you to think of your questions for us. Rizwan, we've been talking about private hospitals. They account for a very large percent of healthcare delivery, I think anywhere between 75% to 89%. We can talk about ABDM, and unless private hospitals are part of this, it really doesn't make a difference. As the chairman of NABH, how do you see this happening? What are some of the things that we should be doing to make sure that private hospitals also become part of this digital fabric that we're building for the country?
So I'll give a slightly longer answer because it needs, that understanding. For any hospital, doesn't matter private or public, to use ABDM, they need to have captured the patient record in a digital format. So what that means is, ABDM often gets compared to UPI. If you think of a UPI what is UPI? It's actually a bridge between two banks. So if I have got an ICICI bank account and Sunita has an HDFC bank account, and if her record is in digital format and mine in digital format, if I have to transfer 100 rupees, then there's a digital message using the UPI bridge, which is going from ICICI bank to HDFC bank, and 100 rupee moves. But imagine my bank had paper records, or her bank had paper records, then the UPI would not work, right? Because now there's no way for the UPI bridge to transfer money or to move any information around because there's a paper record system on the other side. UPI was relatively easier to implement because top 10, 15 banks in India were already digitized, and they have connectors to UPI. Then everybody who has those bank accounts can get onto UPI. In India, there are 100,000 hospitals. And they're all, even the larger ones, if you look at the big chains, they also have a very small market share. So all the big chains are less than 5% of India. So 95% of India is actually the private, the smaller hospitals and clinics and all of them. Now they're on paper record, then ABDM, very difficult, no? Because there's a paper record system on one side. So step number one before we can start to see a lot of ABDM usage is for hospitals to start using what is called electronic medical records. Now the question is, how do you make it easy for hospitals to use electronic medical records to capture patient information? And in the last couple of years at NABH, which, so NABH in a sense covers about, give or take about 12,000 hospitals across the country. So if you put that in perspective, there are 100,000 hospitals. We cover about 12,000 in NABH. So what we are trying to do is we are trying to put in steps to make it easier for hospitals to use a digital. So first of all, last year we introduced something called the NABH Digital Health Standard for hospitals. And we already have about 300 hospitals, including some of the large hospitals who have signed up for it. About 100 of them have already got certified. We are now, very recently, last month, introduced digital health standards for the EMR and HIS product vendors. So now, for example, I don't know if there are any product vendors here. If anybody wants to come and sell a product in the market to a hospital, then there are standard guidelines that NABH has defined of all the features and functionalities that hospital software products must have. Now what that does is, it makes it actually easier for a hospital now to buy software. It becomes easier to buy software because on one hand, NABH has defined the guidelines of how software needs to get used in a hospital. On the flip side, NABH has also given them a master list of all the features which they ought to look out for when they're buying a software product. So all these things are very new. It'll take a couple of years before we'll start to see a more accelerated use. But these are very big steps in the right direction. And there is a tremendous amount of effort that we are putting in as NABH to be able to evangelize the use of digital tools in hospitals. And we are also working with software vendors to explain to them the benefits of complying with the NABH requirements for software. And all that I'm saying is all on the website of NABH. So if you just go to nabh.co, and you will go and you can actually download the digital health standard for hospitals. And you can also go and download the standards for EMR and HIS products out there. And I would encourage anybody who's interested in this broad area of hospital digitization must definitely do that. It's a free download. You can go and get those documents. Yeah. And I'm quite optimistic that these will become good reference documents for the adoption. In addition to that, there are many other things we have to do as NABH and as an industry to drive it, but I'll just pause here for now. Yeah.
Thank you, Rizwan. And I hope through this conversation, and we've touched various points, the lady in the back with the green, I don't know if we can pass a mic to her, and then the lady in the pink here. Yeah.
Hello everyone. Am I audible?
Yeah.
Okay.
Why don't you
so
go?
I am Mansi.
If you can keep it closer to you.
Is it better?
Yes.
Yeah. So as healthcare is totally evolving, with newer technologies are coming. So I want to know, I have two questions. First, I want to know that how are stakeholders disseminating the knowledge on new technologies that is continuously coming? Not only dissemination, but how they are ensuring continuous learning. One is that. And even if the knowledge is being shared, what they are doing so that if the people are facing some challenges in implementation those knowledge, they can come back and ask the questions and they can learn from each other.
Yeah. So you mean building capacity of non-profits or of frontline workers or of people?
So it's all about every stakeholder from non-for-profits to healthcare providers, to the beneficiaries, to the healthcare professionals, and also from the authority side, stakeholder-wise, and what as NGO we can do for them.
Sure. Thank you. Maybe I'll just take this question as well so that we can answer it together. If the mic can go to this person as well. Any other questions in the meantime? There's one here. Okay.
Thank you. I'm Preeti from Great Place to Work. One disclaimer, I walked in slightly late, so I'm not sure if the question was already
Sure.
covered. It's to Rizwan. So Rizwan, I've seen you at earlier organizations, so know how committed you would be to a cause you take up. My question on the NABH front is that while we're looking at digitization, and I heard on, obviously enabling things, when we look at, is the aspect of being able to identify any gaps in the NABH accreditation when we give to a hospital? Because obviously there's a criteria basis which, as a patient, when I go to an NABH hospital, I say, okay, this is accredited. But there are times where maybe the experience doesn't meet that. And there is a way to put in a complaint, and there's a process, etc. I wanted to know, are we trying to address that gap? Because I thought from a user perspective, it's very critical.
Excellent. I'll just take a last question here, and then we'll take a second round of questions. Yeah.
Hello everyone, my name is Dr. Ritesh. I'm from Federation of Indian Psychology. My question is a little elaborative, and it's one small component of healthcare sector. As healthcare and mental health is a part of the National Health Mission also, and we have been analyzed over a period of decades that it's not that much explored or has been implemented at tier 2 and tier 3 cities, especially in the metros. We have little accessibility. Second thing, in the same continuation, the practitioners or the mental health professionals whomsoever would be working will not be having that kind of digital technologies to use. They are still having more of a subjective nature of activities and therapies, which is having more of a subjective nature, which should not be universal, and it can be helpful in the same way across the different geographical locations of the country. Thirdly, the mental health, whomsoever needs. Just
question.
Yeah. The question is, still in the insurance sector, you covered that the medical fraternity in the insurance claim, the mental health is not still covered. Secondly, the professionals who would be using those digital medium for the mental health, still they don't have any standard tools, the digital tools which sir has said about the NABH. Anybody, any tech companies coming with any software would be using for the mental treatment, and that may have the negative impression or the negative effect in terms of treatment. So how exactly we are going to make it standardized so that universally the same kind of technology could be used for mental treatment? And same way,
I'll just pause you there, because I think we'll just take that question and then come back again.
Thank you.
So 3 questions that I picked up. First question that I'm picking up is that there's a need for building capacity across various stakeholders for digital to truly work, and for people to build the capacity of stakeholders as well. What is our approach to doing that? Any ideas from your side will be useful. How do we build better feedback loops for NABH certified hospitals to get feedback? Second. Third is 2 questions there. One is any learnings that you have from your experience around digital and mental health, and around standardization of tools and technologies, and do we need standards for technology solutions that are intervening in the health space? Yeah? Maybe these are the questions, so I'll let you guys take any much of these that you're comfortable with.
I'll take the NABH one. Her question is out of syllabus. So that's on the lighter note, but on a more serious note, I can interpret your question in 3 ways. One is to say, how can the standards become better? There are ways in which you can provide feedback. There are technical committees in different areas of the standard. So the core standard of NABH has been around for almost 16, 17 years. So it's a mature standard, but it keeps on evolving. So there is a place for you to go and give feedback. So that is one. Secondly, you may have the best standard, but sometimes at the point of implementation or at the point of assessment, there may be gaps. And there are ways in which you can, again, as a hospital or as an individual, you can raise those queries. And the third one, which happens a lot, is that a patient may go to an NABH hospital and may not be satisfied with the level of service. And then there is a way you can escalate that concern on the NABH. There is a help desk and there is a method to do that. If you go to the NABH site, you will find it, where you can raise a concern. So there are mechanisms for doing all that. Now, obviously, at the scale at which we are talking about, I mentioned we are doing 12,000 hospitals. So you can also imagine, right, that there will be a lot of individuals who may come from time to time to the NABH website. So it's possible that you may have raised a query and you may not have got exactly the kind of response that you wanted, but there are mechanisms to be able to do that. And we all, like with every good organization, we're always trying to get better at it. Yeah.
You can take it up offline.
We can take it offline. Yeah.
Yeah, I'll just do a very quick response on the training part. I think today it's not being done most efficiently. So a program that has, at least in the government space, a program that is deploying a digital tool will have training associated with that for that particular tool. But what we've found, over the last 5-6 years is we've gone to some remote area in Assam and found that they were using a version of the software that is like 2-3 versions old, right? So these things don't disseminate, don't trickle down the way, if you go with the very traditional way of master trainers and all that stuff that you do normally on the ground, that doesn't work very well. I'm very optimistic about personalized training, all the kind of things, gamification, all the new things that are coming up. I think that will make the training and capacity building much, much more interesting and effective.
Also things like Mission Karma Yogi and the focus on credentialing is now providing a digital infrastructure that makes it a lot more easier, not only to train people, but also to make it observable, which I think is also very, very exciting. Sorry we couldn't take your mental health question. They're signaling me by standing there that this time is up. Thanks so much, everyone. I hope you enjoyed the conversation. The speakers are going to be here around, so do reach out to them offline as well. Thank you, all three of you. Such thoughtful answers and such elaborate perspectives. So really enjoyed our conversation.